Hello out there. I am here to talk to you guys today about, drumroll, erectile dysfunction. I know usually I'm talking about women's health, but I am going to be talking about a series of men's pelvic health issues. And the first one on my list is erectile dysfunction. So most of us are familiar with erectile dysfunction, or ED for short, mainly because of the incredible marketing that the pharmaceutical industry has done in relation to medications for erectile dysfunction. And a lot of times, just when we're hanging out with friends or just kind of joking around, guys and girls can tend to make erectile dysfunction the punchline of jokes. So we think in our society that it's something that's funny, or it's reflective of not being man enough, or that something is wrong with the guy. But I want to kind of ask you to think about that a little bit. There are a couple of things that we need to consider when it comes to erectile dysfunction. First of all, please know that it is a combination of something physical, and then it can turn into something that's still physical, but it starts to have an emotional and mental impact as well. So the next time you think about giving your friend a hard time, or joking about erectile dysfunction, just know that that the person might actually really be struggling. The second thing we need to consider is that erectile dysfunction can be a byproduct or a symptom of something more serious, and we need to be aware of that. So real quick, some common causes of erectile dysfunction, and there's a whole long list, and I'm not going to read them all to you, but I just want to highlight some of them. Heart disease, clogged blood vessels, which makes sense because, there's a restriction of blood flow. But if you have a clot and that clot is released into the body, you could end up with a heart attack or stroke, pulmonary embolism. There's all kinds of serious things that can happen. Some other causes of erectile dysfunction, like I said, it's a long list. So even smoking tobacco can reduce the blood flow and cause erectile dysfunction. So there's a lot. There's a lot. Even it might not even be something completely physical. It could be increased stress, not feeling attractive, not feeling wanted, depression, anxiety, and even medications. Different medications can cause it as well. So some complications of ED. Of course, unsatisfactory sex life. That makes sense. It can cause stress and anxiety, which is what I said earlier. It's almost like a chicken or an egg kind of situation. So which came first? And then they just feed into each other. So it can be this vicious cycle. Of course, relationship and intimacy issues can be a factor. And not that these other ones aren't big, but a big one is if you're in the child rearing or conceiving age group, and you have this issue and you want to have a child, that can make things very difficult. So I don't want you to think it's all bad news. There are things that can be done. If there isn't an obvious underlying medical condition, and you've had a physical and an exam, there are things that you can do to help increase the blood flow and to manage or eliminate those symptoms. And I'll be talking about those in upcoming videos, but I just wanted this to be kind of an introduction for you. So I will see you guys next time. I hope you have a great day.